Hello, this is Dr. Emre Karadeniz, hair transplant surgeon from AEK Hair Clinic, Turkey, and I'm going to give my aftercare instructions. Now, since you had a hair transplant here, most probably you look like this guy over here. Now, the most important instructions for the first 2 days is don't have an accident. That means you have a newly transplanted area and you should not touch, rub, or bump your head so to avoid any damage and graft loss. So that's the most important. After 48 hours, the grafts dry up to a certain extent where the most dangerous period is over, and these grafts will not come out by simply touching. In the first 2 days, you have to be careful not to have an accident and also not to touch or rub the grafted area. Be careful when you sleep in the first 2 nights. You have to lie flat on your back, never lying face down or sideways, which would damage the hairline grafts. You could choose to tuck in some pillows under your arms so you don't roll over. So you have to be careful for 2 nights while you sleep so to not damage your grafts. Now, there's a few medication I'm going to recommend using in the next couple of days. The first one is called Cipro. This is an antibiotic, 500 milligrams ciprofloxacin, which I give prophylactic for 2 days. This tablet is taken twice a day with food, one in the morning and one in the evening. We have given you 1 tablet in the morning before starting surgery. So the second tablet is to be taken this evening with food. The third one tomorrow at breakfast and 4th tomorrow evening. So that's all you need to take. 4 tablets of Cipro antibiotics in total. The second tablet I recommend is using Prednol. This is 16 milligrams of prednisolone. The goal is to reduce fascial swelling that may occur a few days after surgery. I recommend taking this once a day with food for 5 days. So when you have something to eat at the first opportunity, take 1 tablet with food and take 1 each every day around the same time and take 5 tablets in 5 days. Now, there's slight differences in my recommendations depending on which type of surgery I did. Now, if I did only FUE, then I give a few painkiller tablets, that is Paro. Paro is actually 500 milligrams of paracetamol. I recommend you take 2 tablets when you need it. It's optional and you don't have to take it routinely. Now, if I did FUT, that is strip surgery, or a combination of FUT or FUT and FUE, then I give a stronger painkiller. It's this one here. Etol is a strong painkiller. Take this twice a day with food, 1 in the morning and 1 in the evening. Now, for the first 2 days, I recommend taking frequent painkillers to prevent discomfort. After that, you probably don't need anything. In order to use more frequently, I mix this one with this one, Paro. This is paracetamol. So if I did strip surgery on you, my recommendation is that you take Etol twice a day with food and Paro 4 times a day, 2 tablets each time, 4 times 2. Of course, you don't take them together, you take them interchangeably. So when it's with food, I recommend Etol. When it's between food hours, I recommend Paro. So what you're going to do is you're going to take Etol twice a day and Paro 4 times a day. That's 6 times a day you're taking painkillers every 4 hours. When it's with food, you take Etol. When it's between food, you take Paro. And when you take Paro, you take 2 tablets, don't forget. So that's all about the medication. Now I'm going to talk about the aftercare. Now, in most cases, you should be looking like this guy. There's a white bandage that is, that is wrapping the donor area, and there's also a black bandage over it. The black bandage is an elastic bandage. It is meant for reducing the swelling coming down on your face, because a few days later there's significant swelling expected around the face. Now, in general, if I don't recommend otherwise, we will wash and remove the bandage the following morning. So on day 1, come to the clinic for a wash. So what we are going to do is we're going to remove your white bandage. In rare cases that you cannot attend the wash the following morning and you have to leave very early to the airport, I may instruct you to remove your own white bandage 1 day later. In this case, it's very simple. You just take the black bandage off, so you widen it carefully with your hand and take it off without scraping the grafts off, and then you may just cut from one side the white bandage and it just falls. So the following morning, we clean up, we remove the white bandage, and in general we will put the black bandage on again. This black bandage is supposed to stay 4 days, day and night, except for when you need to wash. When you take this off and on, you have to be careful not to damage the graft. So you have to widen it and carefully take it off. And again, when you put it on, you have to widen the bandage and carefully put it back on again. So it should sit on the hairline, in the forehead, and not touch the grafted area. So, washing. So day 1, we removed your bandage, we put the black bandage on. On day 2, I generally recommend not washing. So there's no washing on day 2. Start washing from day 3. On day 3, you remove your black bandage carefully as instructed. And then you take some moisturizing cream. So you take some moisturizing cream in your finger. And then what you do is you just tap with your finger over the grafted area like this. So you don't rub, you just tap. And you leave a thin layer of cream on for about 1 hour so it moisturizes the scabs. 1 hour later, you set your shower at warm temperature and low pressure, and you wet your head with the shower. After that, you take some baby shampoo in your hand, rub it between your palms to make foam, and tap. So what you do is you make foam in your hand and you tap over the scalp like this, and you repeat this until your whole head is covered with the shampoo. Again, there's no direct rubbing, just tapping. Once it's all covered with the shampoo, you rinse all your head with the shower, and then you take a towel in your hand and pat. So you pat it dry. Again, there's no rubbing. So basically, at this period, it's just tapping. There's no rubbing. Repeat this wash, which takes you around 5 minutes to do, every day between day 3 to day 7, unless I instruct otherwise. After finishing your wash on day 3, carefully put your black bandage back on again by carefully looking in the mirror, widening the bandage and placing it on your forehead. Remember, the black bandage is supposed to stay for 4 days, day and night, except for when you are washing. Throw it away on day 4 before washing. In some cases, we may have done an unshaven or limited shaven hair transplant. So this can be FUE or FUT strip. So if we don't shave during the procedure, then there's some slight differences in the washing. So if we don't shave at all, we may instruct you to not wash for 2 days and then wash later. The other thing is that when we don't shave, we don't recommend using a moisturizer before washing, because if you apply moisturizer within existing hairs, it kind of sticks like grease and it's very difficult to wash off. So if we do hair transplants within existing hairs, I don't recommend using a moisturizer. I just simply recommend washing and shampooing. Starting from day 8, now you start rubbing. So you wash in a similar fashion, but the only difference is when you take the shampoo in your hand, that is after applying the moisturizer, an hour later, you take the shampoo and directly you start rubbing over the grafted area so the scabs become loose and they start coming off. So with every wash, some of these scabs should come off, and eventually by day 14, you should have a nice and clean scalp with no scabs at all. So basically, between days 3 to day 7, you wash gently every day without rubbing, but from day 8 to 14, you also wash daily, but you rub with your palms. You don't have to be too harsh, but just give it enough rub so the scabs start coming off. And you can gradually increase that rub day by day if you see, the scabs are still there when you approach days 12, 13, 14, because you want to make sure all scabs are off by that time. Keeping scabs on for longer are actually harmful. So basically you're gentle in the first 1 week. So the danger in the first 1 week is to be too harsh. But the danger in the second week is to be too gentle. So in this case, don't be too gentle. Give it enough rub so you clean all the scabs off by day 14. Now, if we did a strip surgery, then you must have stitches or staples. These are generally removed around 14 days after the procedure. Get staples or stitches removed at 14 days plus or minus 2 days. So that could be anywhere between 12 to 16 days after the surgery, plus and minus 2 days margin. It's not so critical, unless I recommend otherwise. I recommend you don't take alcoholic drinks for 4 days. Not smoking for 48 hours is a good idea, but it's hard to recommend for smokers. Don't do sports, swimming, activities, physical activities for 10 days. Okay? If you had strip, you can extend that to 14 days. If you had strip, don't do, let's say, extensive exercising like weightlifting or crunches that put extensive tension on the neck for 2 months. So you can swim, jog, ride a bicycle, but don't do weightlifting or crunches for another 2 months. For FUE, there's no restrictions. We provide you with a camouflage hat. But the thing is that since the grafted area is very fragile for 48 hours, I don't recommend using a hat which may actually damage the grafts, especially if you had a hairline transplant. It's not possible to put the hat without touching the graft. So avoid the hat for 48 hours. After 48 hours, you can start placing the hat carefully on the black bandage, not pressing. It just sits on the black bandage. Okay? So then you can use the camouflage hat. Baseball caps should be avoided for 2 weeks, which kind of touch or put friction on the grafts. Or woolly hats as well should not be worn in the first 2 weeks. Now, about medication, that's hair loss medication. Hair loss medication is finasteride or it's minoxidil. Now, this is not a routine medicine to follow up with surgery. This is about hair loss. But I still want to give you information. So if you're planning to use finasteride to prevent for future hair loss, you can use a 5 milligram version, which we find easier to find in Turkey. 5 milligram version, but since you need 1 milligram, you have to take quarter of a tablet a day. Or you could take the 1 milligram version and take it once a day. So you can start this anytime, even immediately after surgery. If you want to use minoxidil, so there's different brands. The American brand is Rogaine. It can be a spray or a foam. You can start using this, or if you have been using it, resume using this 3 weeks after the hair transplant. Since it needs to be applied on the recipient area, you start using this 3 weeks after the procedure. Now, what are we expecting to see? The first 4 to 5 months or up to 6 months of the hair transplant, we may see little or even no difference before and after. So you may see no growth in the first 6 months. In fact, these months are called the ugly duckling period of a hair transplant, which means you can actually look worse than before. The reason why is there's thousands of incisions done on the recipient area, and if there's no new hairs, it can only look worse. Especially if the transplant were done within existing hairs, then you may see some shock loss in the existing hair, so it can look thinner than before in the first 6 months. The results of a hair transplant are expected to be visible between 6 to 12 months. For that reason, we ask for updates at 6, 9, and 12 months with verbal feedback and some update with pictures so we see how it's progressing. Hairline transplants tend to show earlier growth than crown transplants. So a hairline transplant should show the result somewhere between 6 to 12 months, whereas crown transplants usually show between 9 to 18 months. So expect a little delay in crown transplants. There may be some slight modifications in my recommendations depending on what we did during the procedure. So I may have add or take out some of those recommendations. Also, we are always behind the phone line or emails. If you have any further questions, please don't hesitate to ask and we will get back to you as soon as possible. Thank you for choosing AEK Hair Clinic. I wish you a nice journey back. I'm looking forward to hearing your updates and goodbye for now.